Congratulations! If you're watching this video, you're approaching one of the most exciting parts of orthodontic treatment, your end of treatment check visit. This appointment is where we evaluate the results we've achieved together, determine whether your treatment goals have been met safely and predictably, and decide what the healthiest and most stable next step is for your smile long term. For most patients, this means transitioning into retainers. For a smaller group of patients, it may mean additional aligners called a refinement to improve or finalize certain details. And occasionally, we may recommend modifying goals, expanding goals, or changing the treatment approach based on how your biology responded to orthodontic movement. In this video, I'll explain why we do an end of treatment visit, how we evaluate your smile and bite, what procedures or next steps may happen during or after this visit. Part 1: Why the end of treatment visit matters. A work of art smile with improved health and function is not only the orthodontic position of the teeth, but also it is the shape of the teeth, the shape of the gums, and the color of the teeth. The goal is to create a healthy bite, stable tooth positions, even forces between the teeth, long-term maintainability, and a smile that looks natural and functions comfortably. Sometimes teeth can appear straight visually, but the bite may still be uneven, unstable, or placing unhealthy pressure on certain teeth. Other times, we may have reached the orthodontic goals, but the patient may have additional cosmetic goals that are more related to tooth shape, color, or repairing pre-existing damage to the teeth or gums. That's why we do a detailed finishing examination before deciding treatment is complete. Why biology matters. Orthodontics is a biological process, not just a mechanical one. Every person's body responds differently to orthodontic forces. For example, some teeth move very predictably, others resist movement. Some patients heal faster, others have strong muscle forces or bruxism that can push teeth out of position. Bruxism, clenching or grinding, is especially important in adult patients because it can deepen the bite over time, push posterior teeth apart, make the front teeth to hit too hard, wear down enamel, or make certain orthodontic goals difficult to achieve or maintain long term. In some cases, this may become more obvious during or after treatment, and we may recommend managing the muscle forces in order to achieve or maintain orthodontic goals. That could include bite adjustments, retainer modifications, biofeedback appliances, night guards, or Botox into the masseter muscles for severe clenching cases. Why some goals may change. Sometimes treatment goals evolve during treatment. For example, your priorities may change, your treatment adherence may have faltered, biology may limit certain movements, or achieving a more advanced goal may require a higher treatment level than originally selected. Examples include midline correction, significant root movement, extrusion mechanics, pre-existing gum recession becomes more noticeable, black triangle reduction, major bite correction, or complex tooth root movements. Some of these movements may require attachments, elastics, more aligners, more IPR, braces, or an upgrade to a higher treatment level such as Impress Plus or Impress Advanced. Part 2. How we evaluate your results. At your visit, we perform an orthodontic examination. This is much more detailed than simply checking whether the teeth look straight. We evaluate bite function, tooth alignment, tooth contacts, spacing, wear patterns, stability, pre-existing tooth or gum damage, and long-term maintainability. How we check the bite. One of the most important parts of the appointment is evaluating your occlusion, meaning how your teeth fit together. We use articulating paper, which leaves colored markings on the teeth when you bite together. This helps us visualize which teeth are touching, whether the bite is balanced on both sides, whether the front teeth are hitting too hard, and whether certain teeth are overloaded or underloaded. A healthy bite is generally even, stable, comfortable, and distributes force across many teeth instead of only a few. We do not believe in a one-size-fits-all approach to bite correction in adults. For children, Textbook perfection is usually the goal because we have the opportunity to guide growth. We have no pre existing conditions of the teeth and gums, no unevenly worn or missing teeth, and we can impose a pedagogical style of treatment. However, for adults, these limitations often make trying to achieve textbook bites more harmful than beneficial, and many adults are unwilling to undergo the increased burdens of higher levels of perfection. Our philosophy is to recommend the highest level of perfection that the patient is willing to adhere to, balanced by the most minimally invasive treatment, as well as the least amount of burden and risk to the teeth and gums. How we measure spaces and tooth fit. We also floss between the teeth and measure any remaining spaces very precisely. Even tiny spaces can matter. We document interdental spacing, overbite, overjet, tooth size discrepancies, rotations, and overall arch coordination. Sometimes patients notice very small details near the end of treatment that become more visible once larger problems are corrected. At this stage, we discuss which details are realistically achievable, which are biologically appropriate, and whether additional treatment is worth the time, cost, and effort required. Please note that there are three types of spaces, and each has different solutions. 1. Interdental spaces, when teeth do not touch their neighbors in the same arch. For example, when flossing, there is no click of the floss. These usually can be fixed simply with orthodontics, either more aligners or adjusting the current aligner or retainer. 2. Interarch spaces. When a patient bites down, there are gaps between the upper and lower teeth. This is due to differences in the gear-like fit of the teeth. Changing this generally requires the use of elastics or braces and is usually recommended for children but is optional for adults because it constitutes more art than science. 3. Tissue windows or black triangles. These are a consequence of gum recession and triangular tooth shape. While we cannot grow back gums after they've been blunted by years of crowding or recession, we can alter tooth shape by reshaping the tooth with additional interproximal reduction or addition of composite dental resin. Either option generally increases treatment time and costs. How we evaluate tooth wear and clenching. We also examine signs of muscle pressure and grinding, including wear facets, scalloping of the tongue, linea alba on the cheeks, tooth mobility, and enamel wear. This helps us determine whether your bite is stable, your retainers may need modifications, or whether muscle forces may continue changing your bite over time and you'd benefit from additional treatments such as Botox or biofeedback to mitigate bruxism. How we evaluate aligner adherence. Orthodontic treatment is highly dependent on adherence. At your EOT visit, we review app monitoring compliance, weekly scan check ins, missed visits, lost or broken aligners, extended gaps in treatment, and overall tray tracking. This matters because additional aligners may or may not be included depending on adherence and original treatment scope. That's also why we ask patients to save every aligner and bring them to every appointment. Sometimes the fastest way forward is actually a few steps back into a previous aligner before continuing treatment. Part 3. What may happen during the Aamodt visit? What procedures are commonly performed? For many patients, this appointment includes removing attachments, elastic buttons, or braces. We polish the attachment material away carefully using enamel-safe techniques designed to preserve healthy enamel while restoring a smooth, natural surface. Then, we take a scan to create your retainer. One clear retainer pair is included with treatment. We recommend keeping your final aligner as a backup in case you lose your retainer, or invest in a backup retainer which can be purchased at a small additional cost to prevent relapse and additional treatment if lost. Your retainers will fit the teeth shape that you finish orthodontic treatment with. So if you have planned dental work, such as replacement fillings, crowns, implants, or bridges, you will need to bring your retainer in to the dentist, who completes those procedures so that they can temporarily alter your final retainer so that it will still fit, and you will need to invest in a replacement retainer that fits perfectly over the new dental work. We cannot delay your retainer fabrication until after your dental work is complete because that risks unwanted tooth movement, and we want to maintain your great orthodontic results. But before we take your final retainer scan, you may benefit from some included services that we can provide for you before you leave the visit at no extra cost. What enameloplasty and equilibration are. Some patients may benefit from enameloplasty or occlusal equilibration. This means carefully reshaping tiny amounts of enamel to improve tooth symmetry, refine uneven edges, reduce sharp areas, improve bite balance, or protect unsupported enamel. This is often especially helpful for teeth that were previously worn unevenly or teeth that spent years in traumatic positions before orthodontics. These procedures are usually very conservative, artistic, and biologically safe. What composite buildups are. Some patients also benefit from cosmetic composite resin buildups to improve tooth shape and size. These are tooth-colored additions bonded directly to teeth to improve tooth proportions, incisal edge shape, symmetry, small chips, worn edges, undersized lateral incisors, or developmental defects. They are non-destructive to the tooth surface, unlike veneers or crowns, which require tooth structure removal. They generally last 5 to 10 years nationwide, but I have one on my front tooth that has lasted 30 years. And yet they can break tomorrow if you bite on something too hard, like an almond, with your front tooth or clench and grind your teeth. The good news is that if they do break off, they can be easily replaced without further damage to the natural tooth. These are not included in the price of orthodontic treatment. Orthodontics aligns the framework of the smile. Sometimes restorative contouring is what completes the final aesthetic result for the next level of improvement. What happens if more treatment is needed? Most patients transition directly into retainers. However, some patients may benefit from additional aligners, minor adjustments to your final aligner or retainer, elastics, new attachments, or upgraded treatment goals. Examples might include closing small residual spaces, improving minor rotations, refining the bite, improving midlines, or improving overjet reduction. One refinement of additional aligners is included for fully compliant patients. However, additional aligners may involve additional cost if treatment goals expanded beyond the original scope, multiple refinement series were already used, or adherence was inadequate. Your doctor will share with you the laboratory costs of additional aligners in these scenarios, ranging from $750 to full cost of treatment. Conclusion: what happens next? What to expect after the visit? At the end of your appointment, we may take new scans, photos, or x-rays. Your retainers may be ordered, additional aligners may be prescribed, or cosmetic or functional procedures may be completed. You'll also receive detailed instructions regarding retainer wear, nighttime for a lifetime, long-term maintenance monitoring, bruxism management, and follow-up expectations. Final message: orthodontic treatment is a partnership. We can design the ideal treatment plan, but long-term success depends heavily on consistency, communication, and your follow-through. Our goal is not just to make teeth look straighter temporarily. Our goal is to help you achieve an improved smile that you can be proud of and a smile that functions beautifully for years to come. Thank you for trusting us with your smile, and we look forward to seeing you at your end of treatment visit.